Good evening, everybody. Welcome. Give us a few minutes here. We're going to get started as promptly as we can. Just want to give lots of folks time to join. Thanks for being here. Today, you are here for our legislative kickoff event. So we'll get started, and Lily will give you all an overview in a second. Lily, I think we've got a solid contingency here. So if you want to kick us off,
All
probably good
right,
to go.
I will get us started. I'm gonna drop the little prompt into the chat for anyone who's just joined. Please introduce yourself in the chat, and James, I will let you keep doing that since I'm sharing my screen. um, all right, I'm Lily Dearwater. I use she, her pronouns. I'm the Economic Inequity and Health Program Manager with Washington Physicians for Social Responsibility. Um, and tonight we are collaborating with not just having one program, we're having the Climate and Health Task Force also with us, and we're going to be talking about our legislative priorities. Um, and with that, I will pass it over to Charles for the land acknowledgement. And as everyone else who's presenting tonight, I'll let you introduce yourselves as we go. So make sure to include that. All right. Charles, over to you. Charles, you're muted.
Great. Hi, I'm going back and forth from screens, so not so easy for me. Hi, and welcome everybody. My name is Charles Mayer, and I'm a family practice doctor, and I'm the co-chair of the um, Economic Inequity and Health Task Force with Lily. So we're starting off, we wanted to start off with thanking the indigenous people in the beautiful land in which we all preside today. 2 months ago, the Washington American Indian Health Commission reviewed with our WPSR Economic Inequity Task Force their 2025 legislative priorities. And as strong supporters, we thought it'd be appropriate tonight to briefly review with them, with you tonight, because that's what we're doing. We plan on working with them throughout the legislative session and into the future. Next slide. Okay, so the next two beautiful slides were made by the American Indian Health Commission. The Health Commission is a group that's driven by is a nonprofit organization that represents 29 tribal governments and 2 urban Indian health programs in Washington state. And they work together to improve the health of Native Americans in the state and Alaska Natives. Next slide. So they reviewed with us. I'm going to review with you now just briefly their top 5 priorities for the 2025 legislative session. The first is Medicaid parity. 60% of American Indian, Native, Alaskan Natives are on a fee-for-service Medicaid. However, many of Medicaid providers actually don't accept fee-for-service. They only accept managed Medicaid. And we want legislation passed that providers must accept both types of Medicaid. Second, hospital crisis coordination. Hospital staff sometimes deliver involuntary treatment, evaluations, and decisions without appropriate coordination with the state behavioral health crisis system and without notification of tribes. We want legislation passed to ensure that they coordinate this care. The third item is Indigenous data protection. Throughout history, Indigenous people have been targets of unethical uses of data causing harm to Native communities. Because of this, we want to have an exemption for American Indians and Alaska Natives from certain public disclosures in certain agencies. You can see I'm not going into too much detail, but we would like, if you're interested in any of this, please reach out to us. The fourth priority is Tribal Foundation for Public Health. we want to see a dramatic increase in public health funding for Native Americans. Right now, they're given less than $200,000 a year, which doesn't even provide for one full-time equivalent for public health. And so we're asking that 10% of foundational public health funding goes towards tribal public health. And then finally, and the Washington State Attorney General's Office and other state agencies are not members of this important Indian Health Advisory Council. Critical work done by the Tribal Opioid and Missing and Murdered Indigenous Women's Task Force need more direct communication with state agencies to get important work done. So we want to see a law passed to ensure that they have to be sitting at the table. So those are the top priorities. We'll be following this and sharing this with you as you join us this session. All right, back over to Lily, who's going to talk about our agenda and get ready to pass amazing legislation this year together.
Thank you so much, Charles. And we'll have actions on those policies throughout the year as well, or throughout the session. So, but if anyone wants to get more engaged on those policies, please feel free to reach out to us. There will be contact information provided throughout this presentation. All right, so what are we here tonight to do? First, we're going to set the stage, talk a little bit about legislative session and who we are as an organization. Then I'm going to go over our economic inequity and health programs policy priorities. Then James will go over the climate and health policy priorities. And then we're going to lead you all in some action, because this is how we do all our meetings. We're going to make you do some advocacy action. We promise we'll make it easy for you this time. All right. So to start out, we want to say a little bit about Washington Physicians for Social Responsibility, or WPSR. I'm sure many of you already know this information, but just in case there's some new folks tonight, we just wanted to let you know a little bit about what we do here. So WPSR is a health professional-led advocacy organization working to create a healthy, just, peaceful, and sustainable world. We leverage the voice of health professionals and those passionate about our work to educate the public, influence decision makers, and promote policies that support our mission of engaging community to create a healthy, peaceful, just, and sustainable world. As an organization, we focus on 3 threats to human health, which are nuclear weapons, climate change, and economic and racial inequity. All of our core areas have their own volunteer task force of WPSR members. Our nuclear weapons abolition work mostly takes place on the federal level, which is why tonight is just the climate and economic inequity task forces. Because both of those programs have a strong focus at the Washington state level. And we're just about to begin the legislative session, which I will tell you a little bit more about. So before we get into policy details, we wanted to talk about how the Washington legislative session works for those who are new. Shout out to our partners at the Poverty Action Network for making this very helpful graphic. And if you want to learn more, I right now will drop an 8-minute video we made describing the legislative process. So check that out another time. All right. So here's the very brief overview. The Washington legislature has 2 chambers, the House and the Senate. A bill is introduced in either the House or the Senate, and then it goes to a policy committee where it has a public hearing, which is an opportunity for us to advocate by testifying or signing in, both of which James will talk about more later. Then after the hearing, the committee votes on whether or not to move the bill forward, and if the vote is successful, it goes to the fiscal committee, where again, there's a public hearing and a vote before it moves to rules. So, getting into the weeds a bit, some bills do skip the policy or fiscal committees depending on their content, but all bills that have made it this far go on to the next committee, which is rules. In rules, there's no hearing before the floor vote, where the entire House or the entire Senate vote on the bill. And if the bill passes the floor vote, then it moves to the other chamber and it does the whole process again. So once a bill passes both chambers, meaning both the House and the Senate, as long as the governor doesn't veto it, it then becomes a law. Many bills don't make it this far. They can stall out in any of the committees and not move to the next step, or they can get voted down along the way. And that's why our advocacy is so important throughout this process, because not only do we show support in a hearing in preparation for a vote, we also reach out to legislators along the way throughout this whole process to keep our bills moving forward. And by we, I mean not just the staff who are doing some of the talking tonight, I mean our task forces, I mean our further email lists. There's a big group of people and our coalition partners. We have so many partners we collaborate with to make this happen. So it takes all of those people, thousands of people, to make this move forward. And so now I'll pass it to James to talk more about the 2025 session specifically.
Awesome. Thank you, Lily. My name is James Moschella. I use he, him pronouns, and I am WPSR's Climate and Health Program Manager. I get to talk to you a little bit about what we're looking at ahead of session, and also to give Lily a quick little speaking break before she has to talk about her own program's priorities. So we wanted to make sure we introduced to you the 2025 biennium. We know that there are folks in this room that have varying levels of experience with the legislature. So if you are unfamiliar with this, essentially Washington uses what's known as a biennium for its legislative sessions and budget. It's a 2-year budget cycle. The first year is a long session, so it runs for about 105 days. And the second year is a short session of about 2 months, 60 days. They do this, you'll hear the term supplemental session also used in referring to the second year of a biennium. And each year, each first year, each long session of a biennium is where a major operating budget and capital budget is passed. So ahead of this biennium, ahead of this long session this year that starts next Monday, we're hearing some key themes and topics that we just want to flag for everybody so that they're aware of these as we enter session. The first and foremost is a budget shortfall. If you talk to anybody that works with legislators, if you talk to a legislator, this will be the first thing that is raised in any meeting. They're expecting a budget shortfall of $10 billion to $12 billion, if not more. What does that mean for our work? Well, that means the first question we're all going to get asked is how do we pay for something? But it means the second question is really, what do we do knowing this information? So a lot of policies will fall by the wayside this year because of that shortfall, and a lot of things will get reprioritized. We know that's a factor heading into session, so we'll just have to work around it like we would any other issue. Another topic that we're focused on is new legislators. This is an awesome thing. I love reporting this out to folks that there are tons of new legislators this year. But of course, what that means is that a lot of them are unfamiliar with our issues, our organization, your names maybe, and our names as well. And so that presents an education kind of barrier for us as we enter session. How do we talk to these folks? How do we make sure they're aware of these types of topics and so on? And then, of course, we have new administration. We have a new governor. We have a new attorney general. What does that mean? Well, we don't really know yet. Governor Bob Ferguson was our attorney general, and he will take office heading into session. And so we're not sure what his administration will do when it comes to policy priorities. We've heard lots in writing. We've heard lots in speeches. Yet when it comes time to act, it's just going to be something for us to track. Where will climate and health, where will economic inequity fall within the governor's priorities? We've heard lots of phrases so far, and I'll let Lily talk about those a little bit later. So next slide. And during session, so this is where you all come in. As I've alluded to, we advocate on both legislation and budgetary issues during session. So I like to flag this for folks because a lot of people think and have a perception that session is just passing bills. I wish it was, because that's way more fun. But working on budgetary issues is also part of the process for us. So that every year, every session, towards the end of session comes what people refer to as budget season, which happens throughout session, but mostly towards the end. And you'll hear phrases like budget proviso come up. And these are just different ways for advocates like yourselves and advocates like us to work on policies that might not be encapsulated by a piece of legislation. So we track both legislation and budgetary issues. And how do you all get engaged? Well, you write letters to our lawmakers, you attend meetings with lawmakers, We have a lot of coalitions that both of our task forces and programs are participants of. And a lot of those coalitions hold lobby days where folks like yourselves can get the opportunity to go to Olympia and attend meetings in person or attend them virtually. And then, of course, we do a lot of tracking bills. We provide testimony for those of you that are interested when the time is right, when a bill reaches a hearing. And then we do a lot of what's referred to as signing in during hearings. So there is a mechanism for advocates to hop on when a bill has a hearing and relay their preference and support or lack of support for a bill by signing in pro or con. And the way we do that is usually by sending out an action alert to our communities and providing a really easy link where you just kind of click and fill out a little button that says so. So those are kind of the main ways we ask everybody to engage. The sky is the limit for you as an advocate. You can engage as much or as little as you want on any issue that we are working on, and we invite everybody to hop in and kind of join the fray. So I guess it's time to dive into our policy priorities now, and I will pass it back to Lily to start with our economic inequity and health program.
Awesome. Thank you, James. And I'm actually going to pass it to my wonderful co-chair, Charles, to do sort of an overview of our program before we go into the nitty-gritty of what the economic inequity and health policies are for this year. So Charles, over to you. Oh, and there was a comment in the chat that it was a little hard to hear you. So maybe project.
Okay.
I bet it's your mic acting up again.
Oh boy. Okay. I'll talk really loudly. So just want to call it a big thanks to Sean and to Lily for putting this whole slide, all the slides together and the whole night. So thank you. Also a big reminder that I know our name is Washington Physicians for Social Responsibility, but all health professionals are and students are encouraged to join us and get involved. We need all of you. So Lily and I are going to share with you a bit more about our task force and some of the specific policies that we'll be fighting for this legislative session. We will cover a whole lot, well, especially Lily will be, but we'll send out all this information afterwards. Please reach out to us anytime if you want to talk more about any of these issues. So our task force is guided, our Economic Inequity and Health Task Force is guided by 3 principles to maximize the health and the well-being of all Washingtonians. 1, that all Washingtonians have enough money, all Washingtonians are housed, and that structural racism no longer creates health inequities. Next, there. So our policy priorities specifically are progressive taxations and housing and homelessness prevention. We advocate for policies way upstream in order to prevent much of the illnesses that we all see downstream in our clinics, in our families, in our neighbors. That's the area we work. Our policy strategies and political effectiveness, as mentioned earlier by Lily, is made possible by participating in really amazing larger coalitions. The Washington Low Income Housing Alliance, Balance Our Tax Code Coalition, the Washington Budget and Policy Center, and the Economic Opportunity Institute. And we meet with them, and we'd love more folks to actually join in our coalition meetings. So back over to Lily now, who will get more specific about upcoming policies that we'll be seeing in the 2025 legislative session.
All right. Thanks, Charles. So James mentioned the budget deficit earlier. Washington State is facing a deficit of $10 to $12 billion over the next 4 years. And so that means that 2025 is the year to pass progressive taxation, because we have 2 options. Either our programs are going to be cut, or we find a way to create an equitable, sustainable revenue source for our state. And we have so much wealth in Washington State. There's really no excuse for cutting programs that people across the state depend on when we have the resources we need right here. So I know taxation is probably new for some of you here. So I want to start by talking about what Washington's tax code looks like. So the way our tax code is set up in Washington state is we have the second most regressive in the country, which means we have a tax code where people struggling to make ends meet pay a much higher percentage of their income, about 14%, compared to the wealthiest Washingtonians, who pay about 4% of their income in taxes. So you can see the way our tax code is set up. It increases economic inequity. And I'm not going to go into all the details about that. That's an entire other presentation. But if you want to know why our tax code is so inequitable, what made it inequitable, how we got here, I am happy to have that conversation. But tonight we're going to talk about how we could pass some policies to fix it, and at the same time raise some revenue to help with our state's budget deficit. So these first tax policies that I'm going to talk about are what I call big ticket tax policies. These are ones that raise billions of dollars. And all these amounts that the policy will raise, they're all estimates that I'm going to present tonight because none of these bills have been filed yet. They'll start to be filed likely next week. And so our first one is one you may have heard of, which is a wealth tax. This is a 1% tax on intangible assets, meaning things like stocks and bonds above 250 million. That's what it was last year. That 1% is not going to change, but perhaps the threshold will. In former Governor Jay Inslee's budget, as he was leaving, he proposed a wealth tax with a threshold of 100 million. And then we know from studies that have been done, we don't want to go any lower than 50 million because it makes it very bureaucratically difficult. So no matter what happens with this bill, it will only be taxing very, very wealthy people. And it's similar to a property tax. So folks who, maybe middle-class folks who own their homes, do pay a property tax on their home, while the wealthiest people, they hold their wealth not in their home, but in these intangible assets like stocks and bonds. So this is a similar sort of property tax, but on stocks and bonds. The money from this, according to last year's bill, and very likely this year's bill, would go towards disability services, education, affordable housing, and a new taxpayer justice account.
I want to jump
A couple
in.
other. Yes, jump in,
and
Charles.
say two things, because we're here to change the narrative. And I saw in the notes, someone mentioned that Jeff Bezos lives in Florida now. We want to make sure everyone knows that there's been studies done that the wealthy do not move any more than anyone else to avoid paying taxes. Although you'll read about that in different places, it's important that we clear up that narrative. And the other narrative we also want to share with you guys, like Lily had said earlier, is that there are plenty of resources in this state. So that is not the problem.
Thank you, Charles. I appreciate it. And also, Charles and I talked ahead of time about how we're up for chiming in for each other's sections. So Charles may continue to do that throughout this. All right. These other policies would be new this year, these other big ticket ones. One is a high earners payroll tax. This would only be paid by employers, not employees. Those of you familiar with Seattle's Jumpstart tax, this would be similar. So this would end payroll tax caps on social programs such as Washington's paid family medical leave or the federal Social Security program, because right now payroll taxes are not paid above 168,000. So if somebody has a salary of 300,000 after 168,000, the rest of that money, no taxes get paid on that for these social programs. And so this would remove that cap to raise money for additional programs here in Washington state. And we don't know what that percentage will be yet, but at 6.5, it could raise 4 billion or more. And then another is our business and occupation tax. So our B&O tax is regressive and can be really difficult for small businesses. And as a reminder, regressive means if you have less money, you pay a higher percentage. But there are a ton of loopholes in this tax for large multinational corporations. And as one legislator described it, this policy is a little like Swiss cheese. So we might fill some of those Swiss cheese holes. And we don't know exactly how this will work out yet, but it has the potential to raise quite a bit of revenue for our state. And then I'm not going to get into the details of all of these tax policies, but these are some other tax policies that would raise several million up to, 150 million. So nothing to scoff at, but not the billions. So the first is the Affordable Homes Act, which we talked about in previous years. This would make our state's real estate excise tax more progressive, meaning the opposite of regressive, and would raise money for affordable housing. The next one, there's this program where companies invest in workforce education, but after 9 million profit, they're exempt from paying anymore. And then our estate tax could also become more progressive. And yeah, those are the other policies. Okay. And lastly, Charles started to talk a little bit about some of this. We wanted to talk to you about talking about taxes because people have a hard time talking about taxes. They see them as this like bureaucratic thing that they don't want to pay. And that is not particularly helpful when you're trying to address economic inequity by passing just tax policies, which is what we're here to do. And so here are some main points to take away. It is possible for us to have a sustainable budget here in Washington if we make a more equitable tax code. We can do it. We have the resources here in the state. There are studies showing that the moving away concern is not as big as, or maybe even doesn't exist, but the studies show that people will stick around for things like family and their communities and their jobs. So it's possible here in Washington. And then another piece is a lot of these tax policies might take some time to implement. So people say, oh, we need money now, but we need now money and we need later money. We need to raise money now and we need to make our budget sustainable long term. And then in talking about taxes, we should talk about what taxes fund. Taxes fund housing, education, disability services, healthcare, and more. Often it's built into the policy, and these policies aren't all written yet, so we don't have exactly what they fund. But once we have that, we should talk about where that tax money will go and how the programs it funds can improve health. All right, now we're going to move away from taxes and talk about a different topic that is of importance to us, which is housing. So, on our task force, we look at housing policies that address upstream factors that affect homelessness, because we want to prevent people from becoming homelessness and prevent people from becoming housing insecure. And that involves things like tenant protections, that involves building more housing, that involves making sure housing is affordable, that involves wage increases, that involves addressing racist policies that have set it up so the rates of homelessness disproportionately affect BIPOC communities. So that's what we take into consideration when we pick out our policies, and we mostly do them in collaboration with our partners, particularly the Washington Low-Income Housing Alliance. And so a big priority this year is rent stabilization, which many of you may have heard about. So this protects tenants and manufactured homeowners by preventing landlords from gouging rents. People have been seeing immense rent increases, and often that causes people to lose their homes. And so this would be rent increases up to 7%, a 6-month notice for rent increases above 3%, and also allowing folks to break their lease if the rent increase is going to be higher. And then there's also additional tenant protections built in, and there's also provisions for landlords, including a landlord resource center, exemptions for nonprofit and public housing, and then even the first 10 years of new construction is exempt from this policy. So landlords can make the profits they need to make, and it will also go a long way in preventing homelessness. The next one, you'll see there's no details because this is brand new and we don't know exactly what it will be, but we want to prevent local governments from criminalizing homelessness. The federal Supreme Court this year ruled in Johnson versus Grants Pass, making it easier for local governments to fine, arrest, and punish people in other ways for surviving outdoors, even if there isn't adequate shelter available. And so we want to pass some policies that make it so people experiencing homelessness aren't further punished just because they're existing as best they can. And so, yes, so we'll see what policies come up in that area. And then housing budget. So we have a few budget asks, and one is 500 million for the Housing Trust Fund. This fund builds and preserves affordable homes, and it supports a wide range of housing needs, rental, home ownership, includes manufactured housing, and then also additional budget for the nonprofit Affordable Housing Repair Fund, which does exactly what it sounds like, repairs. And then homelessness services are facing a big shortfall because their funding source, the document recording fee, has come up quite short. And so we're asking for 253 million to prevent cuts. We actually need more services, but at this point, we're in danger of cuts. And so we're trying to stop cuts. And then the Right to Counsel program, which provides a lawyer for low-income tenants in eviction court. And then lastly, this isn't our two main buckets, but it does balance the economic inequality. We talked about taxes at the wealthy, and then taxing the wealthy, but also we want to talk about how we get funds back to people who need them most. And so these two programs that we will be looking at this year, one is a pilot of baby bonds. So for those who don't know about baby bonds, how the program in its full form would work is that $4,000 would be deposited into accounts for babies on Apple Health in their first year. And then that money would grow because it would be invested. And then when those babies become adults, they could take it out for a wealth building activity, either education, housing, or starting a business. And so in 2025, like James said, we have to pare things down. So we're looking at a pilot where 40 adults who would have qualified would receive $25,000 grants for those same wealth building activities, so we can see the results of what that money could do. And then this is directly part of the tax code, the Working Families Tax Credit, which has done a lot to make our tax code more equitable in Washington state. We're working on expanding it. So currently the Working Families Tax Credit matches the federal tax, where if you're 18 plus and you have a dependent, a child or another dependent, and you qualify, you can receive the credit. But if you have no dependents, you have to be 25 to 64, and we want to change that. Ideally, we want it to be everyone 18 plus. But this year, we're going to focus on the younger age range because of the budget situation, and eventually we'll try to do the full expansion so that everyone 18 plus can receive this credit who needs it. And often in this category, so you may have seen this last year, we have GBI, but GBI, guaranteed basic income, but guaranteed basic income will be on hold this year, and we'll be back in future years. And with that, I'm going to stop sharing and open it up for questions. I know I gave you so much information, and then James is going to give you some more. So if you have any questions, let me know. And I think there's questions in the chat, but I haven't been able to see the chat. So I'm going to try to scroll through really fast. Unless, James, have you been watching it? I see your face.
Lily, I can help you out a little bit here.
Thank you.
Okay, so I'm gonna go from most recent to farthest away, but there was just a comment on the 7% rent increases and that being a compromise. Any more kind of discourse on that you can offer?
Yes, I can. So it is a compromise. It started at 5%. There was actually one bill at a point that was a range 3 to 7% with different things affecting what the landlords got to do. And the 7% that they landed on, same with that first 10 years of construction are exempt. Those are both compromises that they needed to get the bill through the Senate. And based on the lobbyists' experiences, those are still what need to happen to get through the Senate. And they think it should be able to pass in this form. And I am not a lobbyist, so I don't know more than that, but I can find out if you have more questions on that.
The next question I see in the chat is, I believe it was on the wealth tax. It was talking about how assets are assessed, and the quote was capital gains at sale or tax the entire net worth, and how?
That is a great question. Okay, so it's not capital gains, it is the entire net worth. And I know this is something that is in discussion, so I don't have the full answer, but what I can tell you is it's easier to do for publicly traded stocks and bonds. See, already it's nitty gritty. I'm like, let's talk about public versus private funds. All right, so for publicly traded stocks and bonds, there's actually a record of how much those are worth every single day because of how the stock market works. So it's easier to track and monitor. And for other types of intangible assets, which may or may not be included in this bill, I don't exactly know how that works, but it is a huge thing that they've been working on for years to be able to assess intangible assets as a type of property, not the sale. We did the sale, capital gains tax. Shout out to the capital gains tax, which if people say they're adjusting it, that's a myth as far as I am aware. So capital gains is here. It's doing its thing. Were there other further up ones? I see a new one.
Just the new one now.
Okay, great. Regarding the ceiling on payroll taxes, that would, okay, so it's actually, it would not necessarily only apply to Washington programs because it would be a different structure. It wouldn't be like literally removing the cap on Washington paid family medical leave, as far as I understand. It would be like collecting revenue from the money that exists above that cap. I think I could also follow up with our experts to make sure I'm 100% clear on that. But as far as I understand, it's not specifically going into the law and removing the cap. And I know, James, we got to pass it to you fairly soon. So is that so? Any other? We could do one more question if anyone has one. If not, am I correct in assuming tax deferred retirement assets are exempt from the wealth tax? I believe so. There's a lot of exemptions that I didn't list out here. And it's basically like all the things that come up that people are worried about. Every time someone's like, oh no, but people depend on this one thing, it's usually exempt. So I can get the full list of exemptions. Cool. With that, thank you all for listening to me. And I will pass it to James.
Awesome. Thank you, Lily. I feel woefully inadequate right now because none of my policy priorities have anything to do with niche tax policy. So a big shout out to every one of you that do a lot more math on a daily basis than I do. That's entirely overwhelming. Nonetheless, I am happy to talk about our climate and health priorities for this year. So you all should see my screen, which is a little fancy thing with me in the middle. If I got to move left or right, just yell at me to do so. But like I said earlier, James Moschella, he, him, I run our climate and health program. And I am happy to talk about our climate and health priorities. Everything that you hear me talk about is represented on that website behind me. WPSR.org/healthyclimate2025 should have launched today. That is our climate and health legislative agenda webpage. So you are more than welcome to jump on there and review all the information I'm going to talk about at your peril or excitement. And I will do my best to keep that webpage updated all session long. Every detail of what we work on and how we work on them, and any action alerts or things like that should be present there. So with that, I will get started. The priorities I'm going to talk about are all built by our climate and health task force, our legislative team. They're all semblance of iterative input over months and months from folks who have really kind of worked on these issues. So I'm going to talk about the themes of them first, and then I'll dive in a little deeper on what we're really looking for within each of them. So the first kind of topic that we're focused on this session is clean air for all. I took a deep breath before I started speaking, and I was really stoked because I had some clean air. But we're not just focused on outdoor air quality, we're focused on indoor air quality. And I've been cooking all day. And if you know anything about that, you know that even indoors, your air quality can be bad if you're cooking. So I say that to make it a point that we need to focus on all forms of air quality. Where we're really centering with this work is reducing emissions from anesthetic gases, wood stoves, and policies that protect vulnerable communities from pollution. Talk a little bit about that later. Sustainable transportation is another big thing for us. So investing in clean transit options, expanding rail infrastructure, and cutting emissions from ports, shippings, and the marine industry as a whole is a priority for us. Climate resiliency is another one. That to us looks a lot like adapting to extreme weather. And it also focuses on education, mental health resources. The reason we talk about that is because as a whole, climate resiliency and climate adaptation involves a lot of different things. It involves us looking at the way we live, and it involves us looking at the way we plan for the future. So I've had a few questions come up in the past about why portable heat pumps and renters and also mental health resources and education come up, and they're bundled together. But we bundle it as climate resiliency and adaptation. And if you dive a little bit deeper into things, when you talk about extreme weather and extreme heat crises, oftentimes mental health is a big kind of residual health impact of those crises. So that's why they're bundled. And then the last kind of key topic for us is equitable climate funding. So if you're unfamiliar, the state has a Climate Commitment Act. It acts as a carbon tax. And what that does is tax the state's carbon polluters for emitting. And so we want to ensure that the money that goes into that program benefits overburdened communities through energy assistance and through environmental justice programs and other resiliency projects. The funding for that program is supposed to meet a 35% expectation going to overburdened communities. And there is a lot of differing opinions about if we're meeting the mark there. So we are ensuring or working to ensure that that money meets that mark at 35%, if not exceeding it far more than that. And we'll do so by focusing on Climate Commitment Act spending. All right, going to dive a little bit deeper here, but I want to first focus on partners. I want you all to know the folks that we work with during session, because you might think we're at this alone, but that is far from the case. And if you saw earlier when we talk about what we ask others to work on, or we ask others to participate in, one of the things said attend coalition meetings. And if you sign up to do so, you'll probably attend a coalition meeting for one of these folks. So you'll probably recognize some of the logos on here. And if you're here and your logo isn't on there, I'm sorry. But this is just a small list of kind of the partners we work with during session. So the first topic is on clean air to breathe inside and outside. And the reason we bring this up, because of the stat you see. Air pollution causes heart, lung, and brain disease. And most importantly, one thing that we like to focus on looking inwards is that the healthcare sector contributes 5% of global greenhouse gas emissions. So it's a pretty big deal. One of the first things we're going to focus on, and one of our key priorities, is reducing anesthetic gas emissions. And I am going to stop talking for a minute and kick it to the former Climate and Health Task Force co-chair, Mark Bossler, to talk a little bit about this bill and this work.
Thanks. I appreciate it. I have to say, I delayed responding here because Ken just put something in the chat of how to avoid the wealth tax. And that's if you got more than 250 million, give the money to WPSR. So yeah, I like that. So the anesthesia bill, I'm glad I have a chance to talk about this, guys, because this is really a great example of what WPSR should be doing. There was an idea. There were some representatives that were interested in this idea of curbing healthcare related emissions. We had a member of our organization, a long-term member of our organization, who actually did research on ways to reduce greenhouse gas impacts of anesthesia at Children's Hospital. This is Liz Hansen. She wrote a great paper on it. She's got a coalition that's kind of nationwide working on this subject. So we have this data, we know how to get it done, and we have an interest in the legislature. We have Anne Marie Dooley talk to Joe Fitzgibbons. It kind of was like an offhand comment, I believe, like, you ought to work on this at a town hall. And Rep Slatter and Rep Fitzgibbons worked on a bill that was not a perfect bill last session. It didn't make it out of committee, but it gave us an opportunity to step into the fray as an organization and line up some stakeholders and line up folks at the State Anesthesia Association, the State Medical Association, the Dental Association, and we have a meeting coming up, I think, with the State Hospital Association. So that's building those stakeholders allows us to have input into the legislation, go back to our representatives, this is what people like, this is what people don't like, and get people seats at the table for the rulemaking process. The bill can pass, but then how you carry it, how you enact it, it becomes a department level, Department of Ecology level rulemaking. And if you've got a seat at the table and participating, you're going to avoid unintended consequences at your hospital or your clinic, because people are motivated. The State Medical Association, the anesthesiologists, they want to reduce NICE-CAT. They want to reduce the greenhouse gas impacts of anesthesia, and simply reducing desflurane use or preventing leaks of nitrous oxide in your institution can markedly cut your greenhouse gas impact. And this is the low-hanging fruit. What the bill would do, Anne Marie might be right. It might have gotten to the floor. It didn't pass last year. I forget how far it went. But what this bill would do is start a study phase where data is gathered statewide on greenhouse gas impacts of anesthesia, with the idea of implementing a program that would help hospitals, clinics, surgical centers reduce these impacts going forward. And the other good thing is, if we don't lead the way on something like this, nobody else is going to do it. So I'm super proud of WPSR's work on that.
I am, but
No, you're.
Thanks, Mark. Stephen, I see you have your hand raised.
yes. When I was a medical student at Stanford in the early 1970s, they did a study showing that women in the OR would have more miscarriages because of exhaust anesthetic gases. So if I remember correctly, the anesthetic machines, the Boyle's machines, were all configured to exhaust the gases somewhere else out of the OR. I thought this was a national policy, but can you bring me up to date? What happens to the anesthetic gas emissions? Are they just put out into the atmosphere, or what happens to them? Are they
So what's happened, Stephen, that's a great question, is the hospitals implemented means to exhaust the anesthetic gases into the atmosphere. That sounds great if you want to prevent impacts on your OR staff, very necessary. Problem is, desflurane, sevoflurane are really potent greenhouse gases, like thousands of times more potent than CO2. And so if you just dump them into the air, you account, this practice accounts for a large portion of the scope 1 impact of healthcare, and it's readily modifiable. Anesthesiologists tell me that merely reducing your flow rates after induction during the maintenance phase make a big deal on this. The Children's Hospital example is a great one because they found that their OR record use of nitrous versus their purchase order use of nitrous were way off. Well, it turned out their pipes were leaking all over the hospital. When they fixed that, their nitrous oxide impact dropped down without having any impact on their patients, because what the patients needed still went into the patient It just wasn't leaking out into the atmosphere. I hope that answered your question.
I very much love this conversation because as a non-healthcare professional, it's really fun to watch doctors get into it and go too deep. In the interest of time, I do have to move us on. Thank you for this. Stephen, Mark, anyone else in the comments, I am sure you can go on to this for hours, and I would love to do so because it would actually be very helpful for our advocacy. So I'm gonna pause us there on anesthesia for the time being, but it is really good, a really great example of kind of the work that we've been doing and why it's so important that our group of physicians advocate. So I'm gonna keep moving on in the interest of time. But as you can see, anesthetic gases is our biggest kind of climate priority for the time being. And so we'll focus a lot on that during session, and hopefully it does move through the House or Senate this year, and then onto the floor and hopefully into the budget and onto the governor's desk. Some other legislation that we're focused on with regards to air quality, phasing out polluting wood stoves. So this is a piece of legislation that comes from the Department of Ecology. They reached out to us personally asking us to support and work on this bill. This bill is it's a kind of wonky bill. What it really does is just center a lot of changes to state regulations to meet federal air quality standards as it pertains to wood stoves, and do things like help the state destroy wood stoves once they're sold so that they don't go back into sale and practice, because they are significantly harmful to both indoor and outdoor air quality. So we're going to be supporting the Department of Ecology in that work. And then the last one with regards to air quality that we're going to focus on pretty strongly is the Curb Pollution Act. I hope you've heard this before. We were very active in this in past session, and we will do so again. Essentially, what the Curb Pollution Act does, it stands for Cumulative Risk Burden. So it essentially turns the Healthy Environment for All, the HEAL Act, into something with teeth, and it requires places like the Department of Ecology to target areas where there are unregulated pollutants, strengthen protections, provide community input, and really just kind of stop projects that add undue burden and harm air quality in overburdened communities. So it's a bit of a nuanced bill, but it's got a lot of support behind it. And what it would really do is make a direct impact on overburdened communities in Washington and improve air quality in those areas. So we're very excited about that bill. And that is a piece of legislation that will be run by Rep. Mena this year. The next one is that kind of double-sided topic that I mentioned about climate resiliency and addressing the climate crisis. You'll see it's titled here as addressing it with the climate crisis with heat pumps, education, and mental health treatment. So the reason this comes up is the statistic you can see on the left. The 2021 heat dome caused 18 heat-related deaths daily in Washington. It was Washington's deadliest weather-related disaster in history. And some folks who are tangential and participate on our task force actually produced a UW report that made its way around the state and the country that talked a lot about this issue. And one of the key recommendations that came out of that report was that we need to get heat pumps and cooling, portable heat pumps and cooling, into renters' homes. Renters make up anywhere between 40 to 50% of Washingtonians, and they don't have access to a lot of the same programs that we see from the state coming from the Climate Commitment Act to fund transitions to better energy and heating and cooling sources in their homes. So we're trying to answer the question, hey, what program can we start to work on that? I've been working with some partners, some folks on this call. Gordon, I see you. And we're trying to expand access to portable heat pumps for renters through Climate Commitment Act funding. The way we're trying to do this right now is to copy an Oregon piece of legislation. Oregon acted right after the heat pump and passed a bill that started its own program to fund these types of transitions. And we're hopeful that somebody at the state legislature would be willing to do the same here in Washington. So that's that. Beyond that, we're also focused on the mental health aspect. So how can we increase funding and efforts that support youth-focused climate education and provide support to trained providers in climate-aware therapy, integrate psychological first aid into preparedness plans? We need to do this largely through focusing our funding at the state education level for the most part. So here in Washington, that's the superintendent for public instruction. And we'll be looking at ways that we can kind of force through budget provisos to get that funding and support that we need. We're also looking at a program called Climb Time, which has been supported by a few of our partners, in hopes that that education portion of that work might see some extra funding in the budget this year. Rolling right along. Climate health centered transportation system. So transportation is a big contributor to Washington's air pollution. It's 22%. And we're focused on all forms of sustainable transit to improve air quality, reduce disease, promote healthier communities. I know there are some huge transit advocates on this call, so thank you for being here. Thank you for leading this work, because it makes my life so much easier. The key kind of focus here is the Western Washington Rail Act. And that's legislation that will expand low emission transit options and work us towards some modal shift. We're also focused on a few other kind of nuanced pieces of transportation legislation. That means safeguarding what's known as the Advanced Clean Trucks Rule. This is a rule that came down from the feds a while back and is threatened here in Washington. And so we've already seen some pre-filed bills that would work to stop this rule. Long story short here is that the truck lobby and the heavy duty vehicle lobby really cares a lot about lowering or increasing their profit margins. So I'll stop there on that. Other things we're focused on are requiring shore power at ports to cut emissions from docked ships. So what this means is that when ships are docked at a certain port, they might just be spewing fuel and emissions. They might just be burning fuel as opposed to plugging into electric sources. And so we're hoping that Washington State will take up regulations to ensure that at all ports in Washington, they're required to plug in. And then promoting active transportation like biking and walking to improve health. That's the easiest thing I'll have to say all night. But there are a few instances of local level bills that help safe streets transition into active transportation corridors. So we'll be focused on that too. Last kind of topic is a bit nuanced, but it's what I mentioned earlier, that Climate Commitment Act spending expectation and meeting that 35% goal. So how are we going to do that? Well, we're going to focus on funding universal energy assistance programs that reduce utility costs for low-income households. There are lots and lots of different budget provisos that exist to fund landlords to help make these transitions, to fund multifamily housing to make these transitions, and we will be offering our support to every instance of that where we can find it. And then there's a better one, supporting climate resilience projects, including land preservation and green infrastructure. So talking about things like tree canopy and addressing urban heat islands where possible. These are things that happen often in the state's capital budget, which is, for example, like new projects that the state funds, and how we can kind of move away from heat islands, which are a serious threat to human health and really pose negative health outcomes. And adding more green spaces into our state and into our local urban areas is a priority for us. Other legislation and issues that we support. This is just kind of catch-all because I know you all are probably working on other things. I've seen some mentions on plastics and toxics and agriculture. Yes, we are tracking all of those items as they come up, and we're going to be working on them the best we can. Right now, these are some examples of bills that we are in support of as we kind of wait for the legislation to drop. The first one is the recycling reform bill. That's from Zero Waste Washington. And that helps reduce harmful emissions and improve recycling systems. There's lots of limits on chemical recycling, which I was really excited to learn all about. Hopefully we'll see that passed. It was previously referred to as the WRAP Act, and now it has a bit more of a milquetoast name, if I do say so. We will be working on addressing scrubber technology. So scrubber technology is an interesting shipping term that essentially talks about waste in our waters and reducing pollutants from ships that have this specific technology, and we want to ensure that our water systems are clear of it. So there may be regulations that we propose, and this bill may also look like an effort to ensure that ships docked in Washington transition away from dirtier fuel into cleaner fuels. There is a proposal on the table to have a sales ban for gas leaf blowers in the state. And that would be a phase out program that would hopefully reduce emissions, make some of your afternoons and mornings a little bit nicer if you don't have to hear those noisy gas powered leaf blowers, but also protect workers. A lot of workers receive, hand and vibration injuries from running these. So it's something that we're going to be tracking if that bill does get introduced. And then finally is what I mentioned just previously, local streets and speed limit enforcements to kind of make safer neighborhood corridors. So that is the legislation and issues we support, and I will stop there and hopefully take a bunch of questions. Lily, if you can walk me through any comments.
Yes.
I'm sure I
I'm
see
just-
17 messages, so
It's
I'm
okay.
gonna
They
get
aren't all
grilled right
questions.
now.
I promise. Some are conversation, and they're all lovely conversations that you should definitely read later. Okay. Anyway, let's start with questions. So I'm gonna start at the top. I observed that much climate action affects homeowners and consumers. Heat pump, wood burning stove, for example. Staying warm is sort of a basic need. Why? It's blocking something for me, but why not require corporations to cut their emissions, such as gas leaks? LP is transported in pipes, transporting cargo via plane only when necessary and such.
Yeah, that's a great question. It's definitely something that we are active on and on all fronts the best we can. The short answer is that a lot of that is outside of the state's control and into federal control. Things like pipelines are usually regulated federally, so we do a lot of work on preventing expansion of pipelines. There's somebody here, Claire Richards, who's done a ton of work in trying to stop a GTN Express pipeline expansion that runs through the eastern part of the state, for example. We actually have done a ton of work with our partners at Stand.Earth too on protesting Amazon's climate emissions, for example. So there are examples of that. And then the simplest answer is that the state has taken a lot of effort in passing the Climate Commitment Act to stand up to kind of bigger polluters the best that they can. So while we wait to show, essentially pay the dividends on the Climate Commitment Act and show that it works and demonstrate to voters that it really has worked, we will kind of take the piecemeal pieces as part of it too.
Right. And related, you may have mostly addressed it, but recent legislation supported by Climate Solutions, for example, in Front and Centered, I think, asked local communities, cities, counties to plan for reduction of GHG in transportation, but commercial transportation was excluded. Why not emphasize and focus on commercial corporate emissions?
It's a decision out of my control is the short answer. I know Climate Solutions has explored it, and I know that it's something that people are focused on, but as exemplified by that advanced clean trucks defense that we're focused on, the commercial lobby is just pretty strong, and it's something that a lot of climate advocates struggle to fight against. Mark, I saw your hand raised. Was there anything you wanted to add to that?
I was just going to say the way we're working on addressing that is with the trucks bill, and some of the ongoing long-term work on, switching to trains. But we're not trying to be biased against homeowners, and certainly
All right.
against renters.
Yeah, I like the bias against homeowners. We're trying not to as well with our housing policies, even though they really support tenants a lot of the time, I promise. Cool. All right. With so many, next question, which I think both of us could answer, James. With so many critically important issues, how does WPSR focus its legislative work? And is this keeps covering, and we know and are we known as the champion on specific state issues? And Mark answered a bit of this, and so did Charles in the chat, but I figured we could as well. Go ahead, James.
Yeah, well, from my perspective, I rely on everybody else to help me. I rely on healthcare professionals who tap into our task force, who show up to meetings like this, respond to our emails, because they help kind of guide me in terms of what we should be prioritizing and what we should be advocating for. None of these bills are things that I just decided on my own or kind of came up with. They're all built by the work of everybody in this room and folks who are unable to attend tonight that kind of suggested we care about these issues and identified them as having a positive health outcome for us to work on. So that's kind of key for us. And then the other answer to that around the champion piece is, yeah, when I came to WPSR, it was what can we lead? What can we be in charge on? For us right now, that is the anesthesia bill. That's kind of the key thing that WPSR is in the lead on. And we'll keep that as far as we can get for the time being. And as other issues progress and as I have fervent support from folks like yourselves, we will take lead on more things. It's only limited by the capacity of people like yourselves, truthfully.
Awesome. And I'll answer because our program, the economic inequity and health program is a little bit different. So a lot of our policy comes from our coalition partners, which I know is also true. But part of that is because while some of the people on our task force are affected by these policies, for sure, often the people most affected by the policies aren't necessarily health professionals. So we want to work with coalitions who will experience the effects of these economic inequity policies. And so we get a lot of them from our coalition partners. And then we bring them to the task force. And we've also had assessments done on what kind of policies we should focus on, because economic inequity is such a huge topic. So there's a lot of different factors and a lot of people that go into these policies. Cool. Next question. These are all comments. Let's see if I can find another one. School. Mark wants to know if anyone's in Legislative District 48. If you didn't see that in the chat, let him know.
Some inside baseball. We're working on a sponsor for that bill currently. So hopefully somebody's willing to fight the gas-powered leaf blower lobby.
Nice. All right. Next question. Why isn't the Inflation Reduction Act passed under Biden's leadership 2 years ago not been implemented in Washington yet? And is this the same as as the Climate Commitment Act?
It is not the same. That is a great question, and it is something to be very clear on. It is a different thing completely. A large portion of Inflation Reduction Act funding, as it stands, comes in the form of grant funding. So this is where it gets particularly confusing. For example, there's billions of dollars in the IRA that's getting provided to states to conduct these heat pump transitions, for example. And some of the grant programs that come out of the IRA are still under rulemaking. They're still finalizing their parameters for who can take advantage of it, how much money is going to a specific state. And unfortunately, the state has also created its own version of these grant programs and named them very similarly. So it can get quite confusing. That said, there are often like duplicative grant programs, but the good news is that doesn't prohibit anybody from taking advantage of what they can take advantage of. It's just been a slower grind at the federal level to get the rulemaking processes down because the public comment periods are large and longer. The people that engage in it are larger, are greater and more involved with like federal policy making as opposed to at the state level, where it can be a bit of a quicker process. In the Climate Commitment Act, we are seeing over a period of the last few years, we are seeing some of those grant programs start to take off. And we hope that in the near future, more of them will take off. That was kind of the issue at bay with the Initiative 2117. Folks were kind of using the messaging that they aren't seeing any of the funds from the Climate Commitment Act actually trickle into voters, trickle into houses themselves. So hopefully in the next few months, next few years, we will see more of that happen, and also more of that happen from the IRA. The other thing I would note, the next administration will likely do their best to limit a lot of these grant programs from seeing through some of their funding. Is it legal? Will it happen? I cannot answer that for you. Not a lawyer, but they will definitely put some blocks in place so that they can try to stop that funding from trickling through to states like ours. So that is a sad thing to note.
Great. Next question, also related to the Climate Commitment Act. Has anyone heard what Brian Haywood is going to do with his multiple defeated bills? Is he planning to try again? His potential environmental impact alone could be huge.
I don't know. We hope not. Let's just say he's got enough money to do it again if he wants to, and the state doesn't have any restrictions on it. And the one thing that's not mentioned in the climate and health priorities list here is fighting against Initiative 2066. I should have put that on there. I didn't. Initiative 2066 did pass in Washington, and it is under a legal challenge. WPSR, I can announce this. WPSR has joined the lawsuit as a plaintiff, so we hope to see that challenged in court and not follow through. The issue at bay is a single voter issue. I will leave it there and not go into the nuances of it, but we hope to see it knocked down in courts. And if it is not knocked down in courts, that will be a significant hurdle for us to deal with in terms of electrification of homes and building decarbonization. But it will also be a significant boon to people like Brian Haywood, who will see their efforts emboldened and probably want to continue doing that in the future.
And this is back to an earlier conversation. As big picture, who develops the legislative agenda decides on it?
Yeah, so for the climate and health program, we have a task force of roughly 40 members. They are self-selected. They join WPSR one way or another, offer their interest in climate and health, and then join our task force and attend monthly meetings the best they can, stay on our email list, things like that. And then I do some recruiting from that list and offer folks to attend our legislative team, our team meetings, and ask them to come a couple times over the fall and winter and help us prepare priorities. I share what I've learned in other coalition meetings. They share what they've learned in coalition meetings and through their partners and through their own issues. And then we put together a list of priorities that come together from that. And those, our task force meetings, we open them up to everybody. Nobody's prohibited from joining, and nobody is prohibited from contributing to our legislative work either. Lily, what about for your end?
Similar, we don't have a specific legislative committee, but we gather the policies from our partners and coalitions, and we hear what task force members want to prioritize, and we bring it all together and we run it by the task force and go through it. So task force and co-chairs are who make the policy, the legislative agenda.
I don't know if can you hear me now?
Yes.
Oh, great. I just want to add one way that we decide. There are also other health professional organizations that do political work and policy work. And again, we're way upstream. So like our Inequity and Health Task Force works on the items we talked about, but those aren't healthcare issues. They're actually preventing illness in our society. And we do it because we know that's what very healthy countries do, and we're trying to mimic some of those countries that are so much healthier than ours. But I bring that up because there are great organizations that are working on things like gun violence or on single payer. We support that stuff, but we actually will keep that. That's not part of our priority list probably ever. So that's also part of our thinking.
Mark has his hand raised.
Yeah, thanks. I wanted to take a question in the chat. There was a question about the lawsuit against Initiative 2066. We are opposed to the initiative because of its health impacts. The basis of the lawsuit, however, is constitutionality. It's because the initiative asks basically three separate questions. It asks to repeal a piece of legislation. It asks to roll back a regulation from the Building Codes Council, and then prohibit any state or federal government actions that would reduce the risk of the use of gas in homes. So it's three different questions, and you could plausibly believe that someone might want to be free to use gas. I think if they knew what they were doing to themselves, they wouldn't, but be free to use gas, but not want to roll back other legislation. It's so our state law, our state constitution says an initiative has to address one question to the voter. So this is the basis of the lawsuit. We just joined up with a group, Climate Solutions, Front and Centered, WCA, the expected folks are, I think Sierra Club just joined as well. So we're not alone on this. And I don't know if it'll win, but the legal team that's working on it has experience with just this sort of thing, the initiative process, unconstitutional legislation. So
Mark is our point for the lawsuit. So thanks for stepping in there, Mark.
Great. The last thing I see, a fun one, is there really a gas leaf blower lobby?
You know, it's more so the businesses that sell them. The Association of Washington Businesses is the problem there. And apparently some City of Kirkland staffers too. Well, we're working on it.
Oh, fun. All right. We've made it through the chat. Thank you all for your amazing questions. James will pass it over. James will pass it over to you for action.
Awesome, cool. I closed my tab on accident, Lily, so just bear with me.
You want me to share screen?
Yeah, can you?
Yes.
The last section of this everybody, is just taking action. So we're going to show
James,
you.
I will let you drop everything in the chat though, but I'll share the slide.
I'm going to put some links in the chat for you all, but we don't want you to leave here tonight without at least thinking about taking some action, and ideally taking some action. None of this should take too much of your time. Both of our programs, the Economic Inequity and Health Program and the Climate and Health Program, have actions ready to go, which simply allow you to send a summary of our issues to your legislator and ask them to support our issues. So I will paste those links in the chat so you have them all right now. Here's the Economic Inequity one, and here's the Climate one. And you can do this at any time, and we'll have them all through session, and we'll be changing actions and offering new action alerts as time comes. But for now, we're ready to go with asking people to support our policies. And of course, if you are interested in getting more involved with our work, maybe you're not a task force member and you're like, how do I tap in? What do I want to do? You can fill out this simple Google form. It's really short, it's really sweet and to the point, and it offers us some guidance on how you can get engaged or how you might want to get engaged, and we will follow up with you. So please do take some action tonight. Send an email. The process should be pretty simple and straightforward, and get engaged with us over legislative session. One thing that was not mentioned tonight that I do want to leave you all with, there is significant polling, incredible polling data that shows that healthcare professionals are the most trusted people in the country by voters. Everyone trusts what you have to say. And I say that because when people come to these meetings, they might think to themselves, I don't have the opportunity to engage, or my voice doesn't matter as much. But the rest of America thinks your voice matters more than theirs. So use that, leverage that, get engaged, take action, and join us on this journey. Legislative session is tough on all of us, but we're going to do our best to keep you all engaged and involved. You can email WPSR@WPSR.org for any general questions. And then I'll put Lily in my email as well. It's just Lily@WPSR.org and James@WPSR.org. And that's all I have to say. Thank you for coming. Thank you for joining us on a Tuesday night. Glad we could get you out of here a little early. That's awesome. And to all our partners, good luck this year. And to everybody here, thanks for being a part of WPSR. We'll see you soon.